Now then, the Asian elderly are amongst the group that are most vulnerable as social care funding is stretched to deal with the ageing population. That's what we heard from the following the study carried out by David Ward, MP for Lib Dem Bradford East. The study called Reforming Social Care. Mr Ward says the problem is growing and one that isn't going away and needs to be dealt with. Mr Ward joins me now on the line. Hello, David. Thank you very much.
Hello there.
Sorry about the problems with the phones earlier. Now, I'll have to ask you the first question again, David, because we just couldn't hear what you'd said. What has the study revealed exactly, and is it anything that we don't know already?
Well, the background to this is the bill which was introduced, a draft bill last July with a white paper, which is looking at the whole issue of social care and support for carers. As some people say, it's the most radical set of proposals in the whole area of social care for 50 or 60 years. And the reason for it, the need for it, is because we recognise that there is a growing number of people who are growing old. We are, good news, living longer, but along with that comes the increased costs of supporting people as they grow older. And what we've done is we've tried to do a study so we can get a Bradford angle on this. We've had great support from Bradford Alzheimer's Society, Bradford District Age UK, also from the consortia of ethnic minority organisations who have worked very closely with us, so we managed to cover all sections of the community and a fuller understanding of how this may impact on people.
But what are the problems that affect the Asian community that are different to everyone else, David?
Well, this is the reason that we needed to work with the consortia of ethnic minority organisations, because they have contacts within the community, know it very, very well. And what they've identified is that there's a lack of awareness very often and an acceptance of residential care in particular within the South Asian community. It may be strong cultural expectations that family members care for their relatives into old age, and that may act as a barrier to the use of care services. And that, of course, can be quite damaging in terms of the consequences for the health and the welfare of people with care needs and their families.
Now, you've indicated that major reforms are needed to deal with the issues. What are these major reforms that you are proposing?
Well, what the bill will look at, and most people accept the main proposals in principle, and they deal with issues of fairness across the country. There's a bit of a postcode lottery at the moment as to what service you will receive in which different local authority area, but also the mounting cost, the level at which support is provided, also the issue of carers. We tend to forget carers. We rightly focus on the need of those who require care, but the carers need support as well, and that comes with a price tag, and we need to be able to afford it. And we all recognise at the end of the day, whatever the principles may be, unless it is adequately funded, we will not have the quality of services that we need.
Now, do you think there's been an expectation that the Asian communities have generally, in the past, cared for their own elderly and people with disabilities without any help from anybody, and that's the way it's been, and they've seen it as a bit of a taboo subject, really, in terms of going to anybody else for help? And has that expectation been the reason why they're not getting the services actually fitted around their needs?
Well, that's the information that we've received, that there is an indication that is the case. And that would be a shame if that acts as a barrier in some way to first-class care that people require. And we all understand how family members want to stay in the family homes, they want to be cared for by people that they know, but sometimes as people grow old, the needs are beyond those that can be provided for necessarily by immediate members of the family. And so the level and the care and the quality of the care they're receiving is less than it needs to be.
Now, at a time when we are seeing the cuts being made, will the government be putting any money on the table to tackle with the problems you've highlighted? Well,
it will have to, if it's going to square the problem that we have with this terrible national deficit. Everybody's aware of the economic situation, but there will be an additional cost. What we're seeking to do through the bill is to also look at limiting, you may find this surprising, but 40,000 people a year are having to sell their homes to to fund their social care later in life. That is a staggering figure. And so what the government is looking at as part of the proposal is actually capping the level, the total amount that anyone in their lifetime would be required to find and pay for social care. And also increasing the threshold, because at the moment you receive no support whatsoever beyond income levels of £23,500. Now, that's not an awful lot of money. And we think we need to lift that threshold up and to provide more support to people, reduce their need to sell their homes to fund their care.
So how long do you think it's going to be before we see anything happening?
Well, this is going on now. The consultation is taking place. There is a joint committee of the House of Lords and the House of Commons which will be looking at this in the next few months. So we've been invited by the chair of that committee to submit our report to that committee and make a presentation. And as I started by saying, really, this is obviously a set of national proposals, but we need to make sure that the needs of people, Bradfordians, are fully understood by the members who are making the decisions in the House of Commons.
David, thank you very much.
My pleasure. Thank you for asking me.
That was MP David Ward for Lib Dem, Bradford East, talking to me on the study carried out by his office on the need to improve the facilities for the Asian elderly.